All right, back at it again. I got another frequently asked question, and that is, what can I do for my bra line bulge? And so, man, this is one of those areas of the female form that just, drives some women quite crazy. And it's very bothersome to wear bras, and they have this bulging outside their bras. They hate it. They don't like it. They feel like it's a lot of fat. My first, really honest feedback to that is that most women wear bras that are too tight, and so you're naturally going to bulge out a little bit of the bra. So wear a wider bra and not so tight, you don't need it, and then you're less of a bulging. But there are some women who have a little bit extra fatty tissue, and then we typically contour that with body contouring surgery, so like a tummy tuck, liposuction of the back and flank area. So this is a great example of what I did that for her. So again, she had some fullness of her upper back, of her waistline, and she hated this upper back area that's always bulging out of her bra line in her bikinis and swimsuits. And so I did multiple things to her, obviously, but the first thing we did was a contouring procedure with the tummy tuck. I actually extended her tummy tuck incision a little bit further, and the idea is to get this extra skin out on the hip area. And so if you leave it and you stop it there, what's going to happen, you still have this big bulgy area, and that's called a dog ear. And we'll talk about that in the next video. But you do not want to have dog ears. I'm anti-dog ear. But able to recontour her, reduce that with the fatty tissue, remove the extra skin as well, give her a little bit of a hip lift, do some fat transfer to kind of improve her silhouette of her buttock area that flows into a smaller waistline now. And I aggressively did liposuction along her upper back, brought that bra line back in, and so now she's much more refined in her silhouette. She looks a lot better in her clothing. And again, this is a very, very common request that women really don't like. It can be addressed a couple ways, which is just liposuction. If you have a little bit of laxity, we add an energy such as Renuvion, get that soft tissue to tighten up. And if you have even more laxity, we have like stretch marks out of here. Like I said before, we can do surgical procedures such as a bra line torsoplasty. We actually remove that skin and get that laxity out. So anyway, it's a great procedure in addition to typical contouring such as my makeover surgeries and tummy tuck surgeries. So again, hope you learned something. Don't forget, send more questions to me. I'd love to answer them for you, and stay tuned for more.